I recently met with a landscaper from Long Island who had his hip replaced with a hip implant manufactured by a company known as Wright. This gentleman came in to talk to me because his hip implant is failing. It's becoming loose, he's having difficulty with the implant, and he needs to have it replaced. The problem for this patient is that he's a landscaper, he's self-employed, and he has no means to provide for his family if he's not able to work. And unfortunately, the season at which he's about to begin his work and make the most money he makes during the course of a year is beginning now. And unfortunately for him, he's unable to go to work, and he's going to have to undergo painful and potentially dangerous revision surgery, which is going to keep him out of work for several weeks, if not months. And typically in these types of cases, once a patient has already had a hip replacement surgery, second and third and future revision surgeries carry with them more risks of things like tissue loss, bone death, tissue death, and in fact failure of the implant and need for subsequent revision surgery. And ultimately, it often leads to the point where the hip can no longer be revised or replaced, at which point somebody will absolutely be unable to work and will be confined to a wheelchair for the rest of their lives. If you've had a hip replacement surgery and it's failed, or a knee replacement surgery and it's failed, give me a call. I'm happy to talk to you about it. I deal with these types of questions every day. Again, my name's Dan Burke. I'm a lawyer at Burke, Waichman in New York. We're happy to help you out. Thanks very much.